Hello everyone, I am Pratibha Patel, Assistant Professor in Smriti College of Pharmaceutical Education, Indore. Today we start coagulants and anticoagulants. So what is coagulation? Coagulation is the process of conversion of blood from a liquid form into a gel form and formation of blood clot. And homeostasis means is the process to prevent the blood loss. So, homeostasis and blood coagulation involve complex interaction between the injured vessels, wall, platelets, and coagulation factors. This is a normal coagulation process. Two pathways involved in the coagulation cascade. First one is intrinsic system and second one is extrinsic system. So these two pathways evenly merge into a common pathway in the final stage of clot formation. Initiation of intrinsic system pathway involve the sequential activation of factor number 12, factor number 9 and factor number 11. So factor number 9 A initiate the activation of tan to tan A. In addition to extrinsic initiation of extrinsic pathway involve the activation of factor number 7 to 7A, while like factor number 9 also catalyze the conversion of factor number 10 to 10A. Purpose of intrinsic system is maintenance of homeostasis, while extrinsic pathway is activated by trauma. The intrinsic and extrinsic pathway come together with the conversion of factor number 10 to 10A. So the final step in the coagulation cascade involve the conversion of prothrombin to thrombin by the factor number of 10A. So thrombin in turn catalyze the conversion of fibrinogen to soluble fibrin, which then become insoluble fibrin through the action of factor number 13A. 13A is transamidase enzyme. This enzyme catalyzes the formation of isopeptide bond between lysine and glutamine. Between the lysine and glutamine side chain of fibrin molecules resulting in cross-linking fibrin aggregates. Two terms commonly used to describe thrombic condition. First one is thrombus. Thrombus means is a clot adhere to the vascular wall, and embolus. Embolus means is free floating clot in vasculature. Mechanism of action of विटामिन के. ये विटामिन के रिड्यूस्ड फॉर्म में है. पहले ये ऑक्सीडाइज्ड फॉर्म में कन्वर्ट होगा, फिर ये ऑक्सीडाइज्ड विटामिन के इन द प्रेजेंस ऑफ रिडक्टेस एंजाइम वापस से ये रिड्यूस्ड फॉर्म में आता है, दैट इज विटामिन के हाइड्रोक्विनोन. ये हाइड्रोक्विनोन रिक्वायर्ड होता है गामा कार्बोक्सिलेशन के लिए. तो ये जो प्रोथ्रोम्बिन प्रिकर्सर है उसके ग्लूटामिक एसिड को कार्बोक्सिलेट करता है, जिससे वो कन्वर्ट होता है गामा कार्बोक्सी ग्लूटामिक एसिड में. जब ये गामा कार्बोक्सी ग्लूटामिक एसिड में कन्वर्ट होता है तो प्रोथ्रोम्बिन एक्टिव फॉर्म में आता है. ठीक है, जब ये एक्टिव फॉर्म में आता है उसके बाद ही ये बाइंड होगा कैल्शियम आयन से एंड फॉस्फोलिपिड सरफेस से, which is essential for coagulation. Anticoagulants. Anticoagulants are drugs which is used to reduce the coagulation of blood. Now, classification of anticoagulants used in vivo. Parenteral anticoagulants, heparin, low molecular weight heparin, heparin sulfate, dinaparoid. Second is oral anticoagulants, coumarin derivatives. Drug is warfarin sodium. And second one is indendione derivative. Drug is phenandione. Drug used as a in vitro. First heparin and second one is calcium complexing agent. Sodium citrate, sodium oxalate and sodium aditate. These are the structure of oral anticoagulants: warfarin, coumarin, and ani anisinton. Warfarin is also a coumarin derivative. Mechanism of action of oral anticoagulants. So, oral anticoagulants act indirectly by interfering with the synthesis of vitamin K dependent clotting factors in liver. They behave as competitive antagonists of vitamin K and reduce the plasma level of functional clotting factors. They interfere with regeneration of active form of vitamin K, that is hydroquinone form, which carried out the final step of gamma carboxylating glutamate residue of prothrombin and factor number 7, 9 and 10. This carboxylation is essential for ability of the clotting factor to bind to calcium ion and to get bound to phospholipid surface necessary to coagulation sequence to proceed. SAR of oral anticoagulants or coumarin derivatives. This is the general structure of coumarin. Numbering start from here: 1, 2, 3, 4, 5, 6, 7 and 8. So first point is weakly acidic compound due to the 4-hydroxy substitution. 1, 2, 3, 4. 4-hydroxy substitution. Okay, so weakly acidic compound due to the 4-hydroxy substitution. Second point, available as water soluble sodium salt. Next point, the coumarin ring bearing substitution at C3 and C4 is essential for activity. C3 and C4. So substitution at C3 and C4 is essential for activity. Additional methoxy group at C8 increase the anticoagulant activity. Methoxy group at C8 group increase the anticoagulant activity. Warfarin has a chiral center and exhibit stereoselective activity. S enantiomer is 4 times more active than R enantiomer. Now antiplatelet agents. So antiplatelet drugs or platelet aggregation inhibitors is a member of a class of pharmaceuticals that decrease platelet aggregation and inhibit thrombus formation. Useful in prophylaxis of thrombotic disorder. Antiplatelet drugs are more useful in arterial thrombus while anticoagulants more effective in venous thrombosis. These are the drug these are the drugs which interfere with platelets function and may be useful the prophylaxis of thrombotic disorder. Platelets stick to the damaged vessels wall and they stick to each other or form aggregates. Antiplatelet drug. So this is the structure of clopidogrel. Synthesis of warfarin. So starting material is 4-hydroxycoumarine, which react with benzylactone or benzylidene acetone, convert into racemic warfarin. Thank you.